Welcome. We are really glad that you are able to join us today for this informational session on radon testing. I'm Lisa Peterson. I'm a professor at the University of Minnesota, and I study the causes of cancer. I am also one of the lead investigators for the 10,000 Family Studies. The National Cancer Institute has awarded 10,000 families a grant funding to collect information on specific environmental exposures in Minnesota. The success of this work is really dependent on Minnesotans like you who have stepped up to provide their time and information. On behalf of the study team, thank you so much for your generosity. Your participation is really important to help us understand not only whether some environmental exposures cause cancer, but how they cause cancer. An important part of this study is returning information back to study participants, and that's why we're here today. Our objective is to discuss radon, which is one of the exposures we're focused on in this study. For those of you in the audience, those of you in the audience are likely at different places in the study participation pipeline. Some of you perhaps have not yet received a radon kit, and others may have a radon result already. Today, we will have an informational presentation for about 20 minutes. Following the presentation, we will have a question and answer session. To facilitate questions and comments, I would like to call your attention to the tabs at the bottom of the screen. You can see that there is one tab for questions and answers. It says Q&A and another for chat. Please put your questions through the Q&A tab and your comments in the chat. Please feel free to enter your questions during the presentation or save them for the end of the presentation in the Q&A session. Your questions can be specific to your radon result, or they can be more general. In addition, if you have questions about the 10,000 Family Studies, you may ask them here or send us an email. We are recording today's event, so it might be shared on the study website for those that are not able to attend. So now I would like to introduce our radon expert for today's session. Marc Katz comes to us from the Indoor Air Unit at Minnesota Department of Health. He is responsible for planning radon outreach and education activities and has enthusiastically agreed to join us today. Marc is from New Jersey and received his Master of Public Health in Epidemiology and Health Education from Rutgers. Prior to that, he received his undergraduate degree in environmental science. Before joining the Minnesota Department of Health, Marc was the Cancer Coalition Coordinator for the Huntingdon County Health Department in New Jersey and an evaluation coordinator at the University of Minnesota. We are really grateful that he is here today to share the wealth of this expertise and answer your specific questions. He tells us one of his outside work interests is searching for the best New York style pizza in Minnesota. So if you have recommendations, please share those too. With that, I'll turn things over to Marc.
Hi, everyone. I'm going to go ahead and share my screen, my PowerPoint presentation, so you can have that. If someone could give me a thumbs up, maybe, just let me know that you can see the presentation. Great. And so my name is Marc. As Lisa had mentioned, I work at the Minnesota Department of Health in the Indoor Air Unit, where we do a lot of radon stuff. We do more than radon, but today we're going to talk about radon and talk about, for about 20 minutes. And then after 20 minutes, if you have any questions, we'll be here to answer them for you. This is kind of just a brief overview too, but hopefully we'll cover the basics here. And if you want any more information, just let us know. So with that being said, here I am. You have my phone number and email. I gave a presentation about a couple of weeks ago and did get a couple emails after the presentation about some results for the radon test. So feel free to email me the radon results or information that you want anytime, and I'll get back to you and help you out with that. So radon, what is it? Radon is a colorless, odorless, tasteless gas. It's something we don't really think of because it's not really something we see or hear or smell, but it is a radioactive gas. It comes from the ground, from the soil. And It's basically from the breakdown of uranium, which is in mostly all soils. It's in rock. And it breaks down from uranium to radium, and that radium breaks down into the gas we know of as radon. And radon is a gas that is radioactive. And so it is actually the leading cause of lung cancer for people who don't smoke. And the second leading cause for those that smoke, cigarette smoking, of course, being number one. And then, so the soil is the main component of radon. You know, when it gets into the air outside, its average is 0.3 picocuries per liter, picocuries per liter being an unit of measure in the air. It's not a lot at all, really. So when you look at, like, let's see now, oh, there we go. So now with the radon, it dissipates in the air, not really a concern. The biggest concern is radon in the home where it concentrates. And, you know, we live in Minnesota where you know, like now I was looking at the weather report. It's going to be 30 degrees today, I think, or tomorrow. On Thursday, it's probably going to snow, unfortunately. We live in a house that's closed up half the year, even in April, unfortunately, but as it is, we have a lot of cold weather. And because our home is sealed up for half the year, here in Minnesota, we have higher radon levels than most of the nation. So it's a major source inside the home. And when I talked about picocuries per liter, you know, might not have heard of that unit of measure before. And 0.3, you know, what does that even mean? Well, the EPA has a action level of 4.0. So they say in the United States, an action level of 4 or greater, you would want to mitigate the radon levels because they'd be a little bit too high. They would increase your risk for lung cancer too much that you should go ahead and get that decreased. In Europe, the World Health Organization actually has a lower standard, and that's 2.7 picocuries per liter. And that's based more on science, recent science that was done in the 2000s, 2010s. The EPA based their standard on technology back in the 1990s, where the mitigators can get it down to. And back then, they can only get it down to 4. So they said, well, then that's the level we'll do. And so just to say that even though an EPA action level of 4 is the standard in the United States, it's not that black and white. Unfortunately, I like to say, you know, 4 or more is the action level, but 2 to 4 picocuries per liter consider mitigating. And I'll talk a little bit more about that. But just to say that even though the action level is 4, it doesn't stop below 4. There's still some risk, even if it's 3 or 3.2 picocuries per liter as well. So if you look at radon, you look at risk, the EPA did a lot of studies and worked with a lot of meta-analysis. All that really means is they took studies from all these different places, made them bigger, which is where the name meta comes from, and then they analyzed those studies, and they came up with an equation based on that to show that it's estimated that 21,000 people die annually from radon-induced lung cancer in the United States. And they took that equation and kind of made it more myopic, so to speak, and they did radon estimates for Minnesota, and they estimated that about 600 deaths annually occur in Minnesota. So it is quite a bit. We don't think about that. It's an invisible gas, but there are some radon-induced lung cancer risks for sure. And if you're a smoker, it's a bit worse. It's what they would call, or what we would call in epidemiology, a synergistic effect. It just means multiplicative. It means that if you're exposed to smoking and radon, it's not, the risk isn't both of those together, it's multiplicative. It's like 10 times that risk. And so if you were a smoker, current or past smoker, it's a really good idea to get your home tested because your risk is much higher than those that don't smoke. But it's not to say those that didn't smoke, the radon risk is still there, especially in Minnesota, where I had mentioned that the radon levels are quite a bit higher than the rest of the United States. If you were a never smoker, you're still risk, if you were exposed to 4 picocuries per liter, the action level, 24 hours a day, your lifetime risk would be 7 out of 1,000 people would get lung cancer from that dosage. So it's still quite high, and it's a good idea to test. So even if your neighbor's home is 2, it doesn't necessarily be indicative of what your home would be. And your home could be 4, could be 20. Every home is different. So it's a good idea just to test your home. So to look at this little graphic right here, just to give you an idea of Minnesota compared to other states, the US average is 1.3 per picocuries per liter for the radon levels in the US. In Minnesota, it's 4.2, I believe, yeah, 4.2, and the actual level is 4. So really 4.2 means that the average home would be 4.2, and we've done over 200,000 tests that we have collected. So it's a large number of tests. So it's a pretty accurate, and we have a lot of data to support that average. So it's just elevated in Minnesota, unfortunately. And, you know, you might ask, how does radon enter a home? You know, it comes from the soil, but how does it actually get in? And there's really 3 ways that radon gets into the home. And it kind of points to the fact that every home is different and why you should test your home. But the first is the stack effect. Basically, hot air rises, and we're heating up the cold air during the wintertime. And so what happens when we heat up the cold air? It's going to rise and it's going to go up to the attic, and then it's just going to go out the home. Well, the home wants to be under what's called equilibrium or equal pressure. So it needs to get air from somewhere because it just lost a bunch of air. Some of that air comes in from the windows, some from the doors, but some come from the soil. So it's going to pull up some of that gas from the soil gas, and the soil has radon in it. So that'll come into the home. And then because we're heated up and we're also closed up, the radon levels will continue to concentrate in the home, and while we have a little bit higher in Minnesota. The downwind draft effect is just basically barometric pressure changes. When it rains, when it's windy, that wind, whether we even feel it or not, it's going to move through the house, and it's going to change the pressure of the home. So that'll also bring radon into the home. And then lastly, as we all probably have, we've turned on the fans after we're done with the shower, and the moisture is coming out through the roof. Or if you're making a nice dinner and you turn on the oven fan or the range hood, and that air is also going to be pulled out of the home. So what's going to happen? Again, we need fresh air from somewhere because that air is leaving. And part of that air is going to be pulling and tugging from that soil gas and entering in the home. So those are the 3 main ways that radon enters into the home. And then, you know, the common pathway. So we know how it enters in the home, but the pathways that it uses to get into the home are pretty much anything that's connected to the soil. Now, some pumps, if you have a sump pump that's connected to the soil, it's a nice big hole there, or a crawl space. If you have cracks in the slab of the basement, that's another nice area where radon can get in, and it's a gas, so it's going to get in no matter what. But those are big areas that radon will enter into your home. Now, I talked about the data, and we have 10 years of data and 228,000 radon tests. And these are not multiplicative tests; these are just one house, and we'll get the data from all these labs. 8, 10 labs, and now we also get professional data because the pros, who are the ones now, like with real estate transactions, we'd hire a pro to come with their monitor called the continuous radon monitor, and they do a test there. And half the tests in Minnesota are primarily due to real estate transactions. So now we have a lot more robust data set in the last couple of years. In 2019, they had to supply their radon data tests. So we have a lot of data. And as I had mentioned before, 40.3% of the homes, or 2 out of 5 homes in Minnesota, have high radon. And you'll notice on the bottom left or southwest corner of the map, radon levels are quite high. And if I go to the next map, it's a little bit easier to read. The dark blue, 65 to 80% of the homes have high radon in the southwestern corner of Minnesota. It's not to say that even if you lived up in northern Minnesota, wherever that might be, Tasca County, for example, it is green, but it doesn't mean that you're safe. You should always test. The 16 to 35% of the homes in the green will have a high radon, but in the dark blue southwest area, 65 to 80% of the homes will have high radon. So it's quite high, very high in that area or that region. in case you were curious, part of that is due to the Des Moines till. It's a geographic soil area that has high uranium in that soil. So because of that, the radon is a little bit higher in that area. And so this is all stuff I've mentioned before, just laid out in a different graphic format, but 2 out of 5 homes have high radon. And Minnesota is 3 times greater than the rest of the United States for part of the reason, and most of the reason, which I've mentioned before, is wintertime. And also snow. When snow gets on the ground, it's hard with the ice for the radon to go out that way. So it just kind of fills into the home a little bit more too because of the snow cover. So winter, because over winter, the radon levels are a bit higher, and the uranium content in the southwest corner of Minnesota. And in case you were curious, Murray County wins for the highest amount of radon in Minnesota, where what would I say here? 4 out of 5 or 8 out of 10 homes would have high radon level. So quite high. And then Rock County and then Renville County win for next highest counties. So if you live down there, not that you should test everywhere, but you should especially test if you live down in those counties. Now, you might ask, how do you test? And if you did ask, I say that's a wonderful question. So short-term test is the way to go. The most common and the most used test is just a charcoal filter. And that's the ones that you received through the 10,000 families study. And with that, you put it up for 2 to 3. I think you want to do that one 3 to 7 days. And you put up for 3 to 7 days. Other short-term tests go for 2 days if need be, but these tests would go for 3 to 7. And you put it up and you close the windows during that time. So it's a good time during the winter when these windows are closed up. And yeah, and you get your result back in about a week. And then the other short-term test is a continuous radon monitor, which you see there in blue, model CRN 510, just an example of model. And they would use that during real estate transactions. And then the last part is the long-term test. And that would be primarily, you start with the short-term, but the second test may be a long-term, and it would go over a year. And as I said, or maybe I didn't mention, but winter is a little bit higher for radon levels than during the summer. So the long-term test would account for different variations in seasonality and give you an average over the full year. So it's sometimes that's also a good test to see what you're being exposed to if you're curious what it is over the full year. So I had mentioned this before. So the lab analyzes the charcoal kit. It's quite quick. And the continuous radon monitors used during real estate transactions, they put it in the basement. You know, it shows hourly averages, and then they give you a readout after 48 hours and lets you know what that radon level is after 48 hours. So the alpha track, if you think about, as I mentioned before, radon being radioactive, and primarily through the alpha particles. So this is called an alpha track, and there's plastic inside of it. And what really happens is there are alpha particles that hit that plastic and create pop marks. Though, we don't even recognize it, but these alpha particles do cause damage. It's the same they do to our lungs. And they would count up the amount of pop marks divided by the number of days you have it up to give you a long-term average of what that radon level is. So a little bit more about where to place the test for a charcoal filter, which I mentioned. Primarily, this one has a photographic air check. And you don't want to place it too close to the exterior walls because that's where the pressure is. So winds and other things kind of come in through the windows and doors, though we don't really feel it, and it might affect the test. So it's good, or it's better, not good. It's good, or it's better to put that radon test in the middle of the house. And keep it away from things like radiators or not in the kitchen. So a common place to put it would be a family room or a bedroom, TV room, those types of things where you're in most of the day. And then have it up at breathing level. That could mean wherever your mouth is when you're standing, or it could mean if you have a younger child, putting it a little bit lower to see what their exposure will be, but at least 20 inches above the floor. So you might be here too to understand what your radon test results are. And there are some brochures, and I'll point to them that kind of go over that because it could be a little complicated. But the results of the first test will tell you primarily if you should do another test, and should that test be a short-term test or a long-term test. So if your results are 0 to 1.9, you're great, you're good. Retest every 5 years because things change. 2 to 7.9, it's not that high, but I would do another test, of course. Getting like above like 7 or so, I'd probably just do a short-term test and average the two together and see if it's 4 or above the action level. And if it is, you mitigate. But generally what we say is 8 or greater for the first test. You would do a short-term test because it's quite high and you don't want to wait another year before you mitigate. If it's 2 to 7.9 for the first test, do a long-term test and then see what that long-term test result is. If that long-term test result is 4 or greater, mitigate. If it's less than 4, consider it. And what I really mean, and I'll give you an example, is if, for instance, I tested down the basement, right? And down the basement, I just do laundry. And it's 3.2, not going to do anything. But if it's 3.2, and this is a real case scenario for me, is I have my exercise equipment down there and I have an art studio down there. And at night, I'm spending several hours there. And the radon result is 3.2. I thought, well, that might be high enough for me to mitigate. So now I'm doing a long-term test and I'll see what those results are. Even if it's below 4, if it's somewhere between 3.2, 3.4 to over that, then most likely in my instance, I would probably mitigate. And then your second test results, as I had mentioned before, if it's 4 or greater, and this is the average of the two results or what the long-term result is. The second test is basically you average it with the, it's a little complicated. The two short-term tests you would combine together to get an average. If it's a long-term test, that's just an individual test and you take the result of the long-term and see what that is. I hope that makes sense. We can go over it again in the questions. If you are an owner or a renter, you could test yourself. You go to mn.radon.com. And the county health departments as well sell them for maybe $1 or free. So you could contact your local health department and they might be able to give it to you as well. Very briefly about radon mitigation systems. So it's basically the main parts for a radon mitigation system is a pipe and a fan. And the pipe gets put below the slab of the basement, dug into the soil below the slab. And it's like kind of suctions out the radon. It pulls out that radon instead of it coming in through the home willy-nilly. It changes the pressurization underneath the soil, underneath the slab. And with the fan attached, usually in the attic, the fan would turn on and it would pull all that radon out. And then it would discharge it above the roof line. And so the radon, even though it's concentrated, would be above the roof line, and then it would just dilute up there and diffuse with the air. And so that would be that. There are certain things that are on a mitigation system, which why don't I just go right to that? It's a YouTube manometer and an active notification system. Those things would tell you that the fan is working. So if you were to get a mitigation system, these two are like basically performance indicators to say, well, the fan is working. If it's a J, that means it's moving, the air is moving up, and that's basically, it's a die that's connected to the fan that's pulling the air out. If it's a U, it doesn't work. So you need to get that fan fixed. And then there'd be an active notification alarm that would sound as well. So with that, the fan, I'm going to go back up here, maybe confusing you completely now. The radon mitigation system has a tag now. It just started 2 years ago. So with that tag, if you were to have trouble later in the future, you know who installed it and what contractor it is and what their phone number is. So you just call them back. So it used to be radon mitigation systems. They didn't leave that. And you're like, well, I have a system in my house. I have no idea what to do with it and if it works or anything. Now they have a guide that it attaches. So you know how to read everything, like the manometers that I talked about. And it's a system tag, so you'll know who to call as well. They'd seal up the basement. They put the fan in an area that's on condition, preferably the attic, but also maybe outside. They connect it to electric junction box. So that's it in a nutshell. That route the pipe up through the home and outside. And then it should be 10 feet away from windows and above the roof line. So that's kind of very basic what the radon mitigation system is. If you were to hire someone to install a mitigation system, we have they're licensed here in Minnesota. So you could just look them up, put your zip code in, and you can look them up that way. And now we're offering inspection. So after someone installs it, you can call MDH and they can inspect it as well. Excuse me. Effective January 1st, 2014 is the Radon Disclosure Act. If your house is sold, basically they will give you information if they tested the home and what the radon level is. And if they have a mitigation system, they'll tell you that too, along with a brochure, basically a little booklet about radon. So if you're a buyer or a seller, you do negotiate the price of a radon mitigation system. No one's required to test and no one's required to pay for the mitigation system. So important takeaways: radon is a common issue in Minnesota, second leading cause of lung cancer, first leading cause for those that don't smoke. And testing could be done by an owner or renter or a professional if you want to hire them. The action level is 4, but it's never that black and white. And there are radon brochures on our website as well. You just look them up. Just go to mn.gov/radon, pretty simple. And we have a bunch of brochures that help explain radon even further than what I talked about here today. So that's it very much. That's all. Thank you very much. Appreciate your time. Thank you.
Thanks,
I'm gonna
Mark.
stop sharing.
We have a number of questions. Some of them I think you've handled, but I'm going to ask them again. And also we've got somebody that's got their hands raised, but I thought I'd go to these questions first. One person wrote, my results came back at 2.2, and of course that's the level that you say might consider mitigation, but it's also difficult to lower levels below 2. Is it realistic to reduce levels 0.2? And what would you recommend in this situation?
No, I would just 2.2 is safe. They would get it below 2.2. That's kind of at the cusp of really where they get it to. So I would retest every 5 years. I'd probably keep it at that and retest in 5 years. If,
Okay.
They say the 2 to 4 consider, but honestly, it's more on the top range, like 3+ that I would consider. It's kind of, at 2, they're not going to get it much below that, if anything. So, yep.
Okay, and then there was a question about testing only in the winter time, and I think this is for the short test, right?
Yeah, you can test
What do
whatever you want to test. It's like, in health education, we say if you want to test. You don't want to stop you from testing for sure. If if it hits and you're like, I got to do it, then do it. Do it whenever you want to do it. But the radon levels are a bit higher during the wintertime, 1 picocurie per liter more than during the summer. And also we say to close up your house for the duration of the test. So it could mean that you could test during the summer with air conditioning on, but we have National Radon Action Month during January, precisely because it's just easier to test. We have the windows closed, and also the radon levels are a little bit higher. So it gives you a better gauge of what your higher exposures will be. So test anytime, but preferably during the winter.
Okay, great. Now another one gets to, again, back to this 2 to 4 can't risk. And this person asks, how long do people need to be exposed to radon in a home? Oh, greater than 4 picocuries before cancer risk increases. So if their home tests greater than 4, how long do they have to live there before their cancer risk goes up?
Everyone's different. It's just like smoking. Some person could smoke 1 cigarette and then get lung cancer 20 years later. Another person could smoke 2 packs a day and not get cancer at all and die at the ripe old age of 100. It really depends. The risk is there. In general, as I mentioned before, 7 out of 1,000 have a lifetime risk of dying from lung cancer from radon and exposure of 4 or greater. The lifetime risk is a very, it's a hard epidemiological thing to talk about. And I really don't have all the statistics or the background to talk about that in too much detail. But suffice it to say, there is risk in that, and there is risk with 4 or greater, especially. And how long it's going to take just depends on so many things. So it's really hard to gauge, but the evidence does support the idea that if it's 4 or greater, that you would want to go ahead and mitigate. Whether you mitigate now or you do a long-term test and you mitigate a year or 2, that's fine too. It is a chronic exposure. It means over many, many years, how to decipher what many years means is an individual thing and difficult to come to any conclusions on.
Yeah, and that's part of what we're trying to investigate in the 10,000 families study. So there are a number of more questions about risk, like what is the difference? Do you have a sense of what's the difference between a children's risk and an adult risk? I mean,
yeah, I do childcare trainings too, and I talk to childcare in-home daycares. And really what I say is like, why start your children off on the wrong foot? It's like, for instance, my aunt had gotten lung cancer and had died at the age of 35. But, she never smoked. And then her parents were like, well, we never tested for radon. So it's always good just to test and reduce that risk. We don't really know what that risk is for an individual. But as children, let's reduce that risk when they start off on, life. Like, you probably do a lot of things like lead. You try to not have lead paint in the house. Let's try to not have them exposed to high levels of radon. What that risk is when they grow older or may not get lung cancer is really hard to say, but there is that risk. So as parents, I think we just try to reduce that risk.
okay, great. And then there are a couple more here about risks. So do you have an overlay of non-smoking lung cancer rates by county? And do they correlate with radon levels?
Yeah, so I'm not totally sure. I think so. Smoking is the elephant in the room that causes the huge amount of lung cancer.
Including in non-smokers if they're exposed to it secondhand. Yeah,
absolutely. Yeah, and what epidemiology calls like ecological studies, which are studies that just like look directly at like smoking rates or non-smoking rates and see lung cancer in different areas of the state. And unfortunately, you can't do that with radon because people are exposed over many years. They move to different houses. The idea that we could look to see that people smoke or not smoke and see what the lung cancer rates are in different counties is just not, I'm not explaining it totally correctly. And maybe Lisa, you can explain it more, but with these like studies that don't look over time, they have so much bias and fallacy that they don't really mean a whole lot. You really need to do studies over many years, and they've done that before, which is the studies they've done in the US and China and Canada, and this is in like 2010, and they did find after long-term tests that they had like a dosimeter on, and they put them on for like a decade, that they did account for radon and found that the radon risk was quite high. But you just can't do it, unfortunately, just looking at maps and looking if people smoke or not.
right. And it's really amazing that somebody would wear a detector for so long, but that because we actually looked into what would it be possible to actually monitor people's personal radon exposure wearing some kind of gadget, but it was too I think if it exists, it would have been outside of our budget, and the radon, measuring radon in the home is actually a good surrogate for getting a sense of how much people are exposed to. So another question, person wanted us to possibly comment on this: high particulate matter levels are also positively correlated to lung cancer. That's true. And how do you parse radon versus particulate matter when determining cause of lung cancer? So that gets to air, particulate matter could come from air pollution, for example. We get these, fires coming from the West Coast, and we're living in this, or from air pollution. So do you have a sense of that?
No, I don't. I don't have a sense of like, basically when the studies were done, 2000s, 2010s, they did surveys, and I don't know everything that was in the survey. I'd have to go back and look. But they accounted for the most what are called confounders, or confounding variables. They're the variables that they look at the most to see what would also increase the risk of lung cancer. And I'd imagine they would have accounted for particulates as well as smoking history and things like that to find out where those lung cancer risks are and get rid of those other confounders so we can parse them out. But how they did it, I wasn't a principal investigator on those studies, and so I can't really answer to that, how they decided. what the risk is based on these confounding variables like particulate matter. So
Yeah. Okay, I think I've got one more health related one before I move on to the mitigation. So this person is asking if you had data showing that mitigation is in fact lowering the rate of non-smoking lung cancer risk. This person's read that the payback period in terms of numbers of lives saved is something like 50 years. Can you comment on this?
no, I can't. I would have to look at that information. Yeah, I don't know that study and I don't know what it's referring to. So I cannot comment on that.
Okay, great. And so let's just get a little bit into the mitigation system. Somebody wants to know about costs. Do you have a sense of rough approximately?
Yeah, it used to be where we say it was 12 to 1400, but this is before COVID and before the war in Ukraine, and the costs have gone up a lot. So now the average might be around $1,800, but we're still trying to assess that. With inflation and prices, things do keep on going up, unfortunately. So we're trying to assess what that new cost will be. But right now we're going with around $1,800. But I think it's something we have to do is survey the mitigators who are licensed in Minnesota to see how much they're charging to get a better idea, because things have changed so dramatically in the last year or two.
Okay, and when getting a system installed, is it important to have the holes drilled in the basement floor to measure the airflow and ensure the system is working?
Yeah, we actually recommend diagnostic testing, which is where they would go ahead and before they install the system, see where that pipe should be and then what type of fan is needed. And so what they would do is they would make a hole in the four corners of the basement to make sure that they're getting airflow from those four corners and pushing it down so it gets sucked up by the pipe in the basically probably the middle of the basement where they'll drill the hole. So to get a little more technical, what they do is they would find an area where they'd want to go ahead and drill that hole and put the pipe in and kind of shovel out some of that soil to get a good air pressure underneath the slab. And they'd hook it up to a vacuum that imitates the amount of pressure that the fan will have. And then they drill holes in the corners and they go ahead and check the pressure to make sure there's negative pressure and those four corners when that vacuum is on. And they're gonna get a good idea if they're sucking up from all four corners by drilling those holes, and get a good idea of what type of fan they need by how much pressure the vacuum cleaner is doing. And you can turn it up or down to see how much negative pressure is in those four corners. And you want to make sure that once you get negative pressure, you're pretty much good and you don't need a bigger fan, but it helps assess where that pipe should be and what type of fan is needed.
Great. Great. And then how much of an effect does closing up the top of the concrete walls with insulation have? Is it best to do both with the mitigation fan?
I'm sorry, can you read that again, Lisa?
So I think they're talking about putting insulation on top of the concrete blocks. Would that help keep the radon out of the house?
Oh, no, I don't think so. I think it might be good for, for keeping in the heat and reducing costs for heating the home. But in terms of radon, I don't think that will do a whole lot.
Great. And then is the cost of mitigation tax deductible?
I don't know. I'd assume it is not tax deductible because it's part of a, when you do anything, I'm trying to give examples, but in essence, no, I don't think that's a tax deductible thing, but you could talk to your accountant about it and see if it is, or someone who knows more than me. I definitely don't know a whole lot about taxes.
Okay, and do people need to worry about radon exposure where they work?
It's less likely because, especially after COVID, so they're bringing a lot more fresh air in workplaces now, especially buildings. Most of the time, if they do test, hopefully they do test, but if they test the building, they don't have to get a mitigation system. They can just change how the HVAC system works and add more fresh air. And usually in buildings that would get rid of the radon. I'm not a building expert. There are people who are licensed specifically to mitigate buildings. But homes are really what we concentrate on, and we have more ability to change the radon levels through a mitigation system. The balancing of the HVAC system is the primary way that buildings do it. And now with COVID and everything that happened during the pandemic, they have balanced their HVAC systems better, which means that the reduction in radon is more likely.
Okay, great. And then the lung cancer article with Abby Begnall is posted in the chat for people. And then there's a general question about how many families are enrolled and are new participants being recruited. And so we currently have over 2,100 individuals enrolled, and this is from over 900 families. And we're currently recruiting, we're always recruiting, and have goals specific to our environmental grants. So ultimately, we want to bring in 10,000 families. So we're almost up to 10%. So feel free to spread the word and get your friends and family to sign up. This is an important study for us to understand the role that radon, perfluorinated substances, and pesticides like glyphosate. We're focusing particularly on glyphosate and Roundup, what role these three exposures play in blood cancers, but we'll be, monitoring all different. We've got a short-term marker for probability of getting blood cancer, but we'll also be monitoring other health outcomes from the group as things show up over time. So thank you for that question. There was a raised hand. Karen, did your questions get answered, or do you still have a question to ask? You can ask your question. Okay, yes, she got her questions answered.
Lisa, can I also point out, like when we talk about buildings, I now I forget if it's office buildings, they always can be high, but less likely to be high. But in apartment buildings, that's a different story. And you should definitely, if you can, especially garden apartments, test, but then you have to work with the landlord right now. There are no laws protecting the renter or the tenant, unfortunately. It's something that we worked on actually with the University of Minnesota, but it never went through to become a law. So that's kind of where that stands. And with buildings, you can always talk to the building owner or the landlord or whomever to test if it's an office building, because that doesn't hurt too. It doesn't hurt to test as well. And it's usually a pretty simple solution.
Are there any other questions? Comments? Well, great. Well, thank you so much again for joining us today. The success of our research comes from your participation, and you're going to benefit all of Minnesota by participating. So thank you so much.